Hi, I'm Dr. Dean. I'm an eye surgeon working in Nelspruit and Mbombela. And today I'd like to talk to you about pars plana vitrectomy, also known as vitrectomy, also known as retinal surgery. So, surgical retinal conditions are normally treated with a vitrectomy. So whether it's a retinal detachment, a macular hole, a floterectomy, epiretinal membrane peel, diabetic retinopathy, to access the back of the eye and to do retinal surgery, one does a pars plana vitrectomy, often called a PPV. So today I just want to talk through what does that surgery entail, so you have a good understanding of what's actually happening at the time of surgery. So we're going to take it step by step. Okay, so I think the first thing to understand when we talk about pars plana vitrectomy, pars plana is an area in the eye that we use to access the eye, and vitrectomy means to remove the vitreous. So to access the back of the eye, you need to remove the vitreous. Vitreous is the gel in the back of the eye. So if you look at this diagram here, this is the area, this is the gel at the back of the eye that gets removed. And to access the retina, which is this layer at the back, whether there's a hole or a tear, an epiretinal membrane on the surface, a macular hole that needs to be repaired, one has to first remove the gel in the eye. To remove the gel in the eye, we need to get access to the eye. We cannot access it through the front part. Through the cornea, through the lens and the iris, we will cause damage to these structures there. We also cannot access it from the retina. If we put instruments through this part of the eye, we would go through the retina. Going through the retina would cause tear and damage and a retinal detachment, and that would also need to be repaired. And so we access it through this small area called the pars plana, and hence the name pars plana vitrectomy. All our instruments are placed through this area called the pars plana. And so just basically understanding, we normally use 3 ports, sometimes 4 ports. And I'm going to show you what those ports look like now, but essentially they are very, very tiny holes, like little keyholes. You can think of it as micro keyhole surgery because we do all our work through these small ports. These ports often don't need to be sutured, sometimes they do, but they're so small that they're sometimes self-sealing. So there's often a perception that to access the back of the eye, one needs to make large incisions to access that area, when in fact we access it through very small little holes in the back of the eye. One port is for irrigation. It constantly has fluid flowing into the eye because as you suck or remove something out the eye, to prevent the eye from collapsing in on itself, you need to constantly replace that fluid. So this is what we call the irrigation line. On the other 2 ports is where we access the eye. The one port normally is a light source. So it's a small fiber optic cable with a light source on the end that goes into the eye to illuminate the inside of the eye, and that gives us a good view so we can see what's going on. And then the last port is where we put instrumentation, whether it's a vitrectomy cutter or scissors, etc. So this is just a view from the side. You can see here is the irrigation port, so this is where fluid runs in. You can see here is the light pipe or the fiber optic light, which is giving us illumination so we can see. And then this is an instrument that can be a scissors, a forceps, a cutter, or other instruments we use to access and actually do the work. To see the back of the eye, we look through the pupil. So, like most eye surgeries, we dilate the pupil up so we can see the back of the eye. And then we use a viewing system. That viewing system is attached to the microscope. It attaches to the bottom here and has some special lenses that allow us to see at the back of the eye. I use the Zeiss system, so I use the Resight. So this is the Resight system. There is different lenses that can be placed above the eye, allowing us to get a view of the back. We can control it both on the foot pedal or via a dial on the microscope. So we can change focus and see what we're looking at the back of the eye. In terms of instrumentation, I think the most important thing is the vitrector. So vitrector is the tool that we use to cut and suck. So people often want to know, why is this a special tool? Essentially, you can think of it like a vacuum cleaner. On the end of the vacuum cleaner is a very small blade inside the vacuum, and that is constantly cutting. If you had to take a vacuum and you put it onto a closed ball like a soccer ball or a beach ball and you sucked, what would happen is obviously the whole thing would collapse. So we have irrigation that fills the eye to keep it under control. But what's really important in vitrectomy surgery is if you pull on vitreous, it can potentially cause tears on the retina. So as you suck, you have to cut to prevent causing traction. So this instrument, it sucks and it cuts. So if you look at this instrument, this is the end of it. This is where the hole on the side of the cutter where vitreous can come in as it sucks, and inside here is a blade that cuts. This little blade moves backwards and forwards inside this chamber. So as vitreous gets pulled in here, it cuts it and prevents pulling or causing traction on the retina. So that's the vitrector. Then we've got a variety of other instruments like you would have in any toolbox: scissors, forceps, things to hold, grab, peel, etc. And they are small instruments. If you look at them like that, it just looks like it's a needle. But if you zoom in to the end, each instrument has its own different tip. So we have things to grasp, cut, etc. So these are some of the instrumentation, and all these instruments fit in through these small holes to allow us to have access to the back of the eye. So during the surgery, what we do is we first remove all the gel at the back of the eye, and then we can address or fix whatever the issue we are wanting to fix. At the end of the procedure, we pull all the instruments out. Normally we place something in the eye as a tamponade: air, special gases, oil, and then occasionally we may put small sutures, or the wounds may be self-sealing. If they seal themselves, that's great. Occasionally, if they don't seal, one may need to put a suture just to close those holes. So at the end of the case, the only real incisions you've had are these 3 ports that are placed in the pars plana region. So that's the basics of a PPV, or a pars plana vitrectomy, also known as retinal surgery. I hope that was useful. If you want more information on specific conditions like macular hole, retinal detachments, I have some videos on that. But if you have any further questions, please feel free to reach out to us.